Welcome. Welcome. As folks flow in, I'll share about a bit about what to expect today. We're excited to be kicking off applications and admissions for the fourth VOA Futures Fund Community Health Incubator. So each year, we are privileged to work alongside some of the most creative solutions working towards more equitable systems. Today's info session is designed to introduce you to key VOA and seed spot players and familiarize you with the incubator structure. This session will be interactive. We'll utilize the chat and have live Q&A at the end. Let's kick off with some engagement. We want to get the chat warmed up. So drop in the chat as we introduce the agenda, where you are from, your name, and what problem you are solving. So let's go ahead and admit everyone and get going. Let's get that chat warmed up. So our agenda today, introductions. Again, that's your introductions as well, where you are from, your name, and what problem you are solving, and an overview. We'll go ahead and have a history of all things VOA, program overview, as I discussed. We'll talk about the incubator impact, and we're joined by a guest who has actually experienced the incubator herself, who's going to share a bit about her experience. We'll have our Q&A panel. Then we'll chat about what's next. So to kick off introductions, I'll introduce myself. I'm Miranda Williamson. I'm the director of recruitment at Seed Spot. I'll pass it off to Tristan, my colleague, to introduce herself.
Hey everybody, my name is Tristan. I am the VP of Programs for SeedSpot, and I'll hand it over to Tiffany.
Hello, my name is Tiffany Gathers. I'm the Senior Manager of Social Impact Development at the National Office of Volunteers of America, and I'm with the Futures Fund that helps to put on the Community Health Incubator. And I'll throw it over to Stephen Samuel.
Good morning or good afternoon, wherever you are. Stephen Samuels, Vice President of Innovation and Impact Investing, also at the National Office of Volunteers of America.
And let's go ahead and pass it off to Kayla to introduce herself. Just briefly, we'll have a larger introduction later.
Absolutely. Hello, everyone. I'm Kayla Wright Jackson calling in from Middlesex, New Jersey. I was previously in the incubator cohort earlier this year and happy to share my experiences a little bit later in this call.
Great. And with that, let's get started.
So I'm going to take a few minutes, everyone, and just give you a high-level kind of elevator pitch, if you will, of Volunteers of America. And I just want to say thank you for being here. And already it's an honor to be with so many people that are working on community health with a strong equity lens. And, you know, organizations like ours could not do the work that we do without innovators like you. So it's a true honor to be here and to support your work. VOA is considered one of the largest and one of the oldest, or I like to say most experienced, nonprofit housing, health, and human service organizations in the country. We've been around over 127 years. Our name is sometimes confusing, so I'll dispel that right now, which is that, you know, a century plus ago, it was volunteers that took care of some of the most marginalized and vulnerable populations in this country. But today, to do this great work, we do it with over 16,000 employees across the country. And we are a federated organization, meaning that our national office that Tiffany and I work for is based in Alexandria, Virginia. And then we support our 29 affiliates across the country that cover nearly every state and Puerto Rico. Next slide. We touch probably close to 2 million people, I think, these days. And if you look at what populations we serve, some of the biggest populations are certainly those that are experiencing housing insecurity, seniors, the justice involved and formerly incarcerated, individuals with developmental disabilities, veterans. Um, and we do this through hundreds of programs across the country. And we always say that, a homelessness program, in the Carolinas is going to look very different than a homeless program in Nevada. So the wonderful thing about VOA is because we have such entrenched, passionate and skilled people in each community, we really cater and customize our programs to meet the local environment in the most high impactful way that we can. In addition to our affiliates across the country and the national office, which is able to leverage resources to support that work, we also are one of the largest nonprofit developers of affordable housing. So we have close to 25,000 units of affordable housing across the country. Much of that is geared towards seniors and veterans. Um, the bulk of our revenue, which when you roll it all up, equates to probably about $1.5 billion in business every year. The bulk of that is through local, state, and federal contracts. So it's contracts with Health and Human Services, the VA, HUD, the Bureau of Prisons, all the way down to your local, county health departments and health systems. We also do direct services primarily in behavioral health, which is billed directly to Medicaid. The reason that we all get to convene today is that in 2018, Volunteers of America created a subsidiary of the organization devoted to innovation and entrepreneurship. And we created the Futures Fund to accomplish that. And it was seeded originally with one of our corporate partners, Niagara Bottling, and continues to be supported by the Humana Foundation. At this point, we've distributed over $3 million to support the testing and piloting and scaling of innovative programs and new service lines that serve the populations that we do in these communities. The majority of that funding has gone into these 6 key domains that are indicated on this slide: early childhood development, youth, healthcare access, food insecurity, economic stability, and housing stability. We do this all with a strong health equity lens to ensure that the programs that we do design and that we do scale meet the true needs of the community and are done so that in a direct reflection of the communities that we serve. A few years ago, again, with the support of the Humana Foundation, we realized that we really wanted to support external early stage entrepreneurs like yourselves that we felt had the products and the solutions that would not only benefit the communities that we serve, but would enhance our own services and build efficiencies and increase impact for the programs that we have. We realize that an organization like ours can only cultivate so much innovation and entrepreneurship within our organization. We are not a company of entrepreneurs like yourselves, and so the best way to achieve the kinds of outcomes we were looking for is in partnership with folks like you. And so that is why we created the Futures Fund and most recently created the Community Health Incubator. And to that end, we designed this essentially, theory of change model. So hopefully you've been able to glean from your research of VOA and the Community Health Incubator, the why for the purpose for why we're doing this. We have an amazing portfolio of assets at Volunteers of America that you can see here and that I've described. And so it makes a lot of sense to us to leverage these assets to support entrepreneurship outside the company and ultimately be able to bring your solutions to our communities, and in return, to leverage our resources and our network to help you pilot and scale your companies. And that's really the thesis that we have been trying to prove alongside SeedSpot for the past 3 years. And I couldn't be happier to say that we have been getting better and better every year. And, Kayla will be able to describe her experience, but as of the last cohort, we've been able to get a number of pilots off the ground with a variety of different ventures, and we're already, seeing the results of that, and it's really, really exciting. So I think in closing, want to highlight that our sponsor, the Humana Foundation, um, is supporting this endeavor for very, very similar reasons. They, as a payer and a healthcare organization, also realize that to support entrepreneurs who are close to the problems, who have lived experiences, who seek partnership and capital and coaching and training, that is also a means to improving the health of communities across the country. And because they are our sponsor, we lean into several of our shared missions and shared values. And I just want to highlight those here as you consider your application to the incubator. One is, and I've already said it, but just I can't stress it enough, is the idea of how your solution is addressing the inequities in communities. And how you're doing that as a company, and how you're reflecting on that and turning those reflections and those data into to being applicable to your solution. We both share a passion for seniors and veterans and children, and seeing how these solutions impact those populations. We're also both very passionate about loneliness and isolation and mental health and nutrition. And finally, probably most importantly here, is the Humana Foundation's focus on these key states: Louisville, or Kentucky, Florida, Texas, and Louisiana. And again, to dispel any concern, these are 4 states that we're passionate about trying to support entrepreneurship and support pilots. We are not focused exclusively on those 4 states, but you'll hear more later about how, as we're considering applicants and applying our criteria for selecting our final cohort, we do consider, will this solution, are you either from those states, or could we actually be successful in piloting and implementing your solution in those states? So I think that's my close, and I thank you, and I'm so excited to read your applications as they come in. Okay, maybe there's one more. The advisory board. Is this you, Tiffany?
Yes, I can go.
Okay.
Yeah. We'll give you a break. So for those who kind of joined late, my name is Tiffany Gathers, Senior Manager of Social Impact Development. I work with Volunteers of America and help to manage and support the incubators. So just wanted to give you a little bit of information about our advisory board before we go into talking about what the incubator entails. Our advisory board has been very instrumental into really developing the incubator to what it is now. Our board is made up of diverse leaders in social enterprise, healthcare, community services, with their goal of ultimately working to address inequalities. Our board will be available to the incubator as mentor and as coaches as you are going through the 12-week program. Just to highlight a few of how the makeup of some of our board members are, you'll see that we have someone from Humana, we have those who are affiliates, our local offices who are on our board. We have past alumni who are now on our board. We have Kayla, who you'll hear from soon, who was part of our last cohort that we've asked her to join to be a board member, and we're happy that she's accepted. And then we have Claire, who was part of our first incubator cohort in 2022. So all of these leaders will be available for you to have access to ask any questions, or just to see if they can just guide you along with something that they are an expert in. And over to Tristan.
Thank you. So I have the honor of talking about the educational program that you will be exposed to in this incubator. And at a high level, a couple things to point out. We've heard about the importance of health equity. We've heard about the amazing partnerships now from a board perspective, but as well as a broader community with our pilot programming. Funding. You do receive funding for participating in this program, which I think every founder loves to hear. There will be a bit of money provided as a stipend throughout the program, but there is also additional funding post program. And then high level, all of the amazing business skills that we'll focus on. During the program, you'll receive a mentor that will be assigned to you. You let us know the opportunities that you as a founder are having with the business, and we match based on our big pool of amazing mentors. That mentor is there to ride alongside of you, to support you, to cheer you on, to encourage you, and to help open doors. We also set up a ton of meetings with the affiliates. We bring them to our sessions so that you can network and listen to their pain points, connect, and really prepare yourself for partnership. We'll talk about having different assets ready. So if you are interested in doing, let's say, fundraising, what decks, what tools do you need to really help open doors for that conversation? And so over the course of 12 weeks, we'll cover marketing, we'll talk about tech, we'll talk about scaling, we'll talk about mentorship, and ideally, alongside you actually making partnerships, making sales, and increasing your visibility through some awesome new marketing tools. All right, Tiffany, back to you.
So let's talk a little bit about health equity. What makes this incubator different from other programs is our focus on health equity. As you can see through VOA's health equity statement, where we are defining health equity as everyone has a fair and just opportunity to be as healthy as possible. So from beginning of the incubator to the end, we'll work with your company to improve and integrate health equity concepts into your work. Ways that we do this is we provide you with health equity tools, which one of them is an assessment that all of the companies will go through as a team together. And then we'll take that assessment, create an action plan that's actually built into there. And that's something that we'll have our health equity coaches we have one from Humana, an affiliate, part of the VOA national team, will help coach you throughout your time together. And then in general, there'll just be that thought leadership engagement with around health equity as we go through the program. Just to talk a little bit about what has our impact been so far as people company has gone through the program. You can see these 9 areas of where we kind of grouped everyone. This is to show you what we have seen come through the incubator. You do not have to be in these categories, but these are the ones that we have seen that have really resonated with our affiliates. Just to highlight a few of them, you'll see that some of them point out that there are venture partnerships. So that means that they have been able to partner with our affiliates. As Tristan mentioned, that's something that we work on bringing those affiliates into the room, literally into the room when we are at the national conference, and then developing those relationships as the program goes on. We have also done follow-on investments for those who have finished with the program and have partnered with our affiliates. And we have had affiliates actually go through the incubator. So that is one thing that we love to see happen is our affiliates and the ventures coming together and to go through this program and to kind of just share best practices with each other. To point out a little bit more along this side, you'll see as something that Tristan has mentioned, we have deployed over $400,000 in capacity grants. So as you go through the incubator, you will get $15,000 as a unrestricted grant for your company. And then once the program ends, if you are doing a pilot with an affiliate and want to test and try that out with them, you're eligible for up to an additional $10,000 grant to work with an affiliate or maybe 1 or 2 more. And let me make sure I'm touching on everything. Yeah. And then again, like with the follow-on investment, that is something that we can discuss towards the end of the program if you're interested on an investment for your company of up to $200,000. And I think we can move to the next slide. Just to highlight a little bit about what have these partnerships look like, I just wanted to just show one, and you'll hear from Kayla from Transition about what her partnership has been so far with VOA Texas. But just to point out, our ventures have met with affiliates in those key Humana states, and some have not been in those key Humana states, but they have presented their product to these affiliates, pitch to them, and then eventually have discussed what a partnership can look like. The great thing is that we have seen this past year about 5 partnerships taken off. Usually in the past couple of years, these have taken a while to develop. So I would just encourage you just to let you know, sometimes they can happen right away, or sometimes they can take up to a year for partnerships. It really depends on the affiliate and what their bandwidth is and engaging right away. But one thing I want to prepare you for is this incubator is really about going through those business concepts, but also learning how to integrate and work with our affiliates. We really want you to walk away from this experience on with having developed those partnerships and really expanding your product and services into the VOA market. And I'll pause there. And I think next up, we'll throw it over to Kayla to share about her experience and being a part of the incubator. Kayla.
All right. Well, hello, everybody. I'm so happy to be here today and share my experience. I'll just start a little bit about Transition. I'll give you a little 60-second pitch. So I'm the CEO and co-founder at Transition, and we are building the first workforce platform that's bridging the gap between skilled education and employment in order to maximize job readiness and placement success. And we're starting in healthcare. The demand for skilled professionals is at an all-time high. There's millions of aspiring job seekers now pursuing these in-demand career paths, but they often lack guidance to successfully enter the workforce. And employers spend over $100 billion annually trying to recruit and retain this talent, but often struggle to match with the right candidates. So here's what we've done so far to transform how skilled job seekers enter the workforce. We've embedded virtual career centers into 40 workforce partners, equipping professionals with essential career readiness tools. And these centers have organically attracted more than 100 employers who were eager to connect with the vetted talent. As a result, we facilitated over 9,000 candidate-employer connections, which dramatically improved candidate confidence and job placement, as well as improving hiring efficiency. So we helped employers not only hire faster, but also increase their 60-day retention rates from 30 to 90%. So we collaborate with organizations like Volunteers of America, Texas, that have dedicated workforce development programs to help them effectively manage and track their participant outcomes, which is something that they've been doing manually up until this point. So partnerships like these have been really impactful in helping us maximize our support for America's skilled economy. So, a little bit about my experience with the incubator. First of all, it was very memorable. I wish I was still in it. Best program I ever went through. We kicked off at the national conference in Maryland. That was really impactful because we had the opportunity to meet with several affiliates, their leadership team. We did like speed meetings. We had opportunities like, pitch our value propositions, and that really helped us to foster meaningful connections and conversations that, we later took after the conference. Again, the content that we were dealing with during the conference and after that, sessions that were provided by SeedSpot and the Community Health Incubator, they were very valuable. I found them to be perfectly aligned with our company's stage at that time, which was, we were focusing heavy on refining our solution, our value proposition, so that we could effectively go sell our product. And as an early stage founder, what I found most valuable is that, they really try to help us get customers and partnerships. And this incubator was all about that. That was the whole goal. And what I loved even more is that there are tons of affiliates, right, across the nation. So, if you have the opportunity to impress one, and really make a impact for them, you have the opportunity to, work with other VOA affiliates because you're now a trusted partner in their network. So there's a lot of opportunity to work with this group. And I really appreciated the collaboration and the dedication from the leadership team, Stephen, Tiffany, Tristan, Miranda, everybody that was involved. They really made sure that all the founders received maximum value from the program, that we were really connecting with the right affiliates. And that was just priceless. I had just never experienced so much support to really help you past, just the simple things like funding. Like funding is great, but when you can really help a founder get partnerships and clients, that's amazing. So a little bit of how our partnership emerged. Well, our first partnership emerged during one of the roundtable discussions that we had at the conference. So it was like pitch dating. I met two remarkable women from Volunteers of America Texas group, and within just 10 minutes, it was pretty evident that this was a perfect collaboration opportunity. Like when it really fits, it fits. And for them, it fit because they have a growing workforce development program. They actually just received another grant for that. So, they're looking to write us into that 5-year grant. It was just a really exciting opportunity to talk at the conference face to face, about the logistics of, how could this work? And then the deal was signed within 2 months, but like as Tiffany mentioned, anything about B2B sales, like it could range from a couple months to a year, however long it takes. But I think the most important thing to do as a founder is make sure that, you're coming with your ducks in a row so that the organization has a very easy lift because they're already, really busy. They have a lot of clients that they're supporting. So what you can do as a founder to make a potential pilot as easy as possible to say yes to, definitely doing that. Definitely do that. And the most exciting thing that was really cool for us to see is that we always knew we could work with nonprofit organizations. We knew about these workforce programs, but it wasn't until we joined this program that we actually had the opportunity to, launch a pilot with one of these groups. And we're just so excited because we know that it can really help us maximize our efforts at transition. So super happy that we were in the incubator. We're still engaging with several affiliates, telling them about what we're doing with VOA Texas. They're always getting grant opportunities. So as soon as one gets a grant, we're talking to them as well about either starting a workforce program or enhancing their workforce program. So it's really just the ongoing relationship. Met up with Steven in California one time. It's really a family. It feels like being a part of this incubator. And, recently, as mentioned, I was nominated to serve on the Community Health Incubator Advisory Board. So I'm really excited to just continue to support the founders, support the program. I think what they're doing is absolutely amazing. And again, it is my favorite program thus far. That's all I've got.
Thank you so much, Kayla. We have questions in the chat for you that we
Oh,
will
yes.
during our Q&A. So thank you so much for being a part of this.
All right, so there were some questions about the strategies, the framework, the lessons throughout the program. We call it the program schedule. So you'll notice that it has these really, really organized numbers, session 1 through session 10. Well, what does that mean? Part of the curriculum we have decided before we meet you, and you can see those topics over on the right. We've got pitching and storytelling, sales, how to close, partnership, and some of it we decide upon once we meet you and we see the needs of the organizations. For example, we had a very strategic partner come in and talk about marketing, specifically marketing in the world of healthcare. We had another strategic partner offer to come in and do a session on AI that sadly we just didn't have time for. We are constantly evolving our process, our roadmap to really include the needs of the ventures in the cohort. One thing I'm super excited to talk about is how we kick the entire program off. So you'll notice that we'll all be heading on a family vacation. I mean, a trip to Indianapolis, where we'll go to the conference and you'll have a chance to meet the cohort in person. But more importantly, you'll get to meet the affiliates in person. And this is where you start building relationships with the community that you're trying to support and serve. And then throughout the entire program, Tiffany is working tirelessly to have you reconnect, continue those conversations, and deepen them. So that by the end of the program, our showcase, you're pitching your 3-minute business. They're in the audience and they're excited to work with you and excited for next steps. These dates, we give them to you ahead of time because we know as founders, you are busy as can be. And so if you are seriously considering this program, this is the time that we're asking of you so that you can be fully present in our programming. All right. Now let's talk about that timeline a little deeper. I'll pass it over to Tiffany.
Yep. So as you can see here, this is our timeline for how the program all runs. We have the early action application will be due in mid to end January. And then once everything starts being finalized after applications are completed in May is where we start jumping into programming. We do meet a month before the conference just to go over logistics. There'll be some paperwork that you'll need to complete for VOA and for us to get the funding for you to you, but also for you to get your accommodations, the hotel room, but also your flights over to Indianapolis. So, which is why we kind of start early, but programming doesn't officially start until we're at the national conference in Indianapolis. And then once that ends, right before Labor Day, afterwards we'll have some check-in time. So we'll have one about a month later, and then towards the end of October. And then after that, we'll integrate you into our alumni network for VOA. And that will be one like where we'll meet about twice a year just to hear about how things are going. But in general, once you're part of the incubator, you're more than welcome to reach out to especially Stephen and I at any time after the program has concluded, along with SeedSpot, you'll be part of their alumni network. But with the VOA one, we'll be open to work with you if you have still developing those partnerships or trying to seek additional funding. We're open to meeting at any time. And this has been the case even from our first cohort in 2022 till now. We're still meeting with people whenever they need to.
Great. I'm going to go ahead and take over and remove some mystery about the process. There are often a lot of questions about what to expect once you go ahead and submit that application. So step one, you're in the info session. So you are in step one, attend that info session. You will want to submit your online application. It is free to apply. You should expect to spend a significant amount of time drafting that application. It is very important. We use your application to determine whether or not you move forward into the next phase. So take the time. We give you 250 words to complete each question. Utilize that space to fully explain your work. You will be reviewed within 2 weeks. At that time, you'll know if you are moving forward to the next phase, which is a 20-minute interview. It is not that scary. It is usually with myself, and I'm very friendly, so don't be afraid of that interview. The next phase of the journey, if you're moved forward after that interview, would be to be reviewed by the VOA committee, which is the board of advisors who you met earlier. Tiffany shared that slide. You would be reviewed by that entire team and committee, and then it would be determined whether or not you are the correct participant for this upcoming program. We receive a lot of applications, so please don't think it's a reflection on your work if you do not get into this program. We have to make some tough decisions during this process, and really appreciate everyone who takes the time and energy to apply. So what's next? Submit that application. I really encourage folks to apply by that early action deadline. That is January 21st. The final application deadline is March 3rd. And as Tiffany shared in the timeline, the incubator begins May 7th. So I really encourage folks to get in by that early action deadline. That is pretty important. We do review those applications as quickly as we can once folks are in. And by getting in at that early action deadline, that really allows us time if we have questions. If there are questions remaining from your application, if there are any reasons why we need to know more information, we can reach out to you, and we will reach out to you if we have that time to do so. So it really is a great opportunity to get your application in early and have additional consideration. I'm going to go ahead and stop sharing now, and we're going to go ahead and begin our Q&A portion of the program. Well, there we go. I can see all your lovely faces now, and I know we have some questions in the chat already. So we're going to go ahead and use our raise hand feature. Everyone know how to do that? It's a raise hand Zoom feature, and then I will call on you to unmute and ask your questions. But before we get started with that, we do have some questions in the chat I'd like to go ahead and ask. So one question, this is for Kayla. If you could go back and do it again, is there anything you'd approach differently during the program? This is from Emily to Kayla.
That's a good question, Emily. I was actually just looking at that. I answered your first part. I don't know if I would really, if I would do anything differently, I might say, well, to be honest, right? When I first went in, we thought our solution was going to be different. Okay, we thought our solution was going to be more tailored to supporting these groups with direct hiring. Okay, but it changed. It turned into supporting these groups with their own workforce development initiatives. So if I could go back and if I knew that ahead of time, I would have been more intentional about making that solution the forefront sooner. But that's it. Honestly, it was a great learning experience. There's not a whole lot I would change. I did a lot of engaging with the other affiliates, really trying to learn. I would say we did a lot of learning because every affiliate is different. So I would say that's something we did well, and I guess I would do that more, asking more affiliates about specific type of initiatives that they have going, or initiatives that they may be interested in pursuing. We also were super focused on healthcare, but we're also getting a lot of interest for other industries that these affiliates want to support. They want to support manufacturing and construction. So having more of an open mindset about how we could support them with that, that would be something I'd do differently.
Great. And don't mute yet, Kayla. This next question is great. It's also from Emily. What tools, frameworks, or strategies did you take away that you still use today?
Yeah, great question. Keep it simple. Our product is a marketplace and it can get complex. I would say, the more simple you can make your solution, making it directly applicable to that specific affiliate, the more value you will receive. If you try to overwhelm them with all the other aspects of what your product does, it could get kind of overwhelming. So just make sure you do your research and know exactly what that affiliate is into. So listen and learn from them.
Great.
I wanted to add something that Kayla mentioned I thought was really key is being adaptable. We had a lot of ventures that went through the incubator this past year that were same thing. They were interacting with our affiliates and realized that their solution could be really adapted to the problem that they are having. So many of them adapted what they had to what the affiliate needed. So if you find that your product can do that too, I think you'll go along really far with our affiliates.
Courtney, would you like to unmute and ask your question?
Yes, thank you. I apologize. I missed maybe like the first 5 to 10 minutes, but I was wondering what the time commitment involved is. I see that you guys have sessions and stuff like that, but like on a weekly basis, what type of time commitment is involved? And then I actually had two questions. My second question is, if we are not accepted into this cohort, are you guys offering others throughout the year?
I'll pass the first part of this question off to Tristan, and then I'll let Stephen answer the second part.
So time commitment, I think actually Caleb could probably jump in and say, I think it ranges based on the founder and the founding team. So if you are a solo founder, that workload would look different than if you have a team supporting you where you can divide the content and divide the work. Much of the work is the follow-up, right? It's following up with the contacts you made. It's scheduling your one-on-one with your mentor. It's following up with the partners. It's reaching out into the community on your own. So the classes themselves, we meet for just 90 minutes a week. We have that kickoff event, which is a multiple day travel to Indiana, a mixture of state and city there. But move over Indianapolis because we're coming to town, and we'll be there for about 2.5 days in total. And then yeah, it's 90 minutes of classwork. I would give yourself 30 minutes afterwards to kind of action the tools and the resources learned in class. And then follow on. It depends on, again, size of team and your kind of desire for adding or taking away from workload. Kayla, anything to add to that? Did you feel like it was more?
No, I think it was what I liked too is that all the sessions you knew up front when they were going to be, how long they were going to be, who was going to be there, so you could plan accordingly. They were all recorded as well, which is nice, but I made it a habit to attend every session just so you make sure you get that content up front and ask any questions you can. But yeah, the time commitment was very manageable, and all the sessions were critical to be there for, so it's definitely worth your time.
Okay, thank you.
I think a simple answer is you get out of it what you put into it. I mean, Kayla, I can tell you, like we make a lot of people available to you, but we don't do it for you. So, those in the cohort that like reach out to all the advisory board members or the ones that make sense and meet with them because they do make themselves available for 30-minute calls. I mean, there's a lot of opportunity there for connections and insights and networking, your mentor, your coach, and then there's always someone in the cohort that just doesn't, put that time in and I think the results speak for themselves. In regards to other cohorts, the Volunteers of America Community Health Incubator only runs one cohort a year. However, I'll turn it back to Miranda and Tristan. I believe, Seed Spot might have some other, programs that might be suitable, if not this Community Health Incubator, they run some other programs, but we only have one per year.
Yes, absolutely. Seed Spot runs other programs. If you're looking for additional support and resources in the form of an accelerator, please reach out to me, and I'm the best person to share more about that. Sean, you have your hand raised. Let's go to you before we get to Veronica's question in the chat.
Awesome. Can you hear me okay? Great. Thank you all very much for this info session. It looks like a great opportunity, especially pertaining to generating customer partnership opportunities. My question is, as far as the application goes, what are some main attributes you guys use to evaluate applicants?
I'll answer that question. A big key attribute we look for is traction. We look at what your demonstrated traction is. Do you have a minimum viable product? Are you currently in a position to form a partnership or a pilot that could potentially be successful with Volunteers of America? That is a big key factor for this particular program. Tristan or Stephen, do you want to jump in with any addition?
I can't stress it enough, but again, the ability and flexibility to partner with the affiliates, to listen to their pain points and to adapt. So Kayla spoke to it, what she thought she was coming into the program with. We often see that in our conference. We do some business model activities and just kind of thinking about, again, the pain points from the affiliates and how your product or service could fit into their jigsaw puzzle. There was a question in the chat earlier about, are we looking for idea phase or further along businesses? And, traction, a prototype or a minimal viable product, but also the ability to be agile is truly, it doesn't matter the phase of business. It's more of a mindset, in my opinion, because we've worked with businesses that were very far along, but because their teams were big and they had investors or whatever the reasoning was it was more difficult for them to be agile and work with the affiliates and meet them at their needs. And then we've seen earlier phase businesses really step up in this program, find capacity, and make it work. So I wish I could tell you that it's, these are the three things and every company looks exactly like this. But the truth is, our affiliates have unique needs, our businesses have unique founders, and it's more of an art than a science. And so, again, if anything, it's the ability to be flexible and agile when working within a community.
Yeah, I'll add to that. It's a holistic review process. So we look at all responses to each question and use that all that information that we have to determine whether or not it's a good fit. It's not like a law school where there's one benchmark that's not met and you're thrown out. It's a holistic review process.
And if I had to add one, and you covered it so well, but maybe the one for me when I think about all of the applicants and the selection process is, Volunteers of America primarily serves a Medicaid population. And there's a lot of unique aspects to that, not only in regards to your consumer profile, but the business models, the revenue models that need to kind of go along with that market. And so there's a lot of great products and services we've seen that, are their go-to-market strategy is for the private payer market, and that's fine. And so it's tough if we can't see a way that it really can fit the Medicaid market, low income populations, then that also makes it difficult for us to select that venture.
Absolutely. Okay, I'm going to go ahead and move on to Veronica's question in the chat. And this is for Kayla. Did you engage with community affiliates to access support like Chamber of Commerce or Texas Workforce?
Veronica, can you clarify your question? Do you mean like before I started engaging with VOA Texas or after?
Yes, for like a pilot, I'm thinking that I'm a retired military person, and honestly, veterans really don't know much about um, like Medicare, the requirement to have, this Medicare at 65 years old. And so I live in San Antonio. It's a military community. But for the pilot, maybe it's too far of a reach to begin to engage with the VA initially. Maybe I should just try to understand the platform I'm trying to stand on before reaching out to the VA. So, how did you go about making a decision who to reach out to for the pilot versus just kind of going forward and pushing to what you wanted to accomplish?
Okay. So we actually connected directly with the affiliate at the conference. So that was nice, right? That doesn't happen often, but we connected directly with their chief operating officer and the director of the workforce program. So when you connect directly to the decision makers, right, things happen a lot faster. So for us, that was just more of a conversation. We knew what they were getting into. We knew what they were involved in. So that was a direct connection. But beforehand, we had looked at some organizations just, across the nation that had workforce programs. And we knew that because of some of the schools that we worked with, some of the organizations we already worked with, they get funding or they get some sponsorships from some of these organizations. So we knew that they were out there. We were aware of some of these organizations, but we had no introductions to them. That was always the issue. When you're trying to sell B2B, introductions are so important. So we had an idea of who we were looking for, but we didn't, again, have that opportunity until we actually got in this incubator.
Kayla, that's an amazing answer. That is one key differentiation between this program and a lot of others is we give you those introductions to run potential programs and partnerships and pilots. Laura, you have your hand raised.
Hi, can you guys hear me?
Yes.
Is there a preference for for-profit versus nonprofit? Or, guess that's an important question. I see that both are able to apply.
Yes, I'll let Stephen go ahead and tackle this question. Is there a preference?
There is not a preference. Um, if there was a preference that might be tangentially related, it would be the ability to scale. So we have seen some nonprofits that are actually, very community based and would probably struggle to scale beyond their community. And so that makes it a tougher proposition. But if that's not a factor, we treat the two the same.
Thank you.
Great. Are there any final questions as we get ready to wrap up our session here and our time together? Laura, your hand is raised again.
Since you asked, I do have more. And I don't know if I could get this off of online, which is why I figured I'd ask with the opportunity. I've seen some other programs that desire a leader that is full time in that venture. Um, I haven't, in transparency, been through the application yet. But I was just wondering if that was also a selecting factor or preference, or not necessarily.
I'll begin to respond to that question and then I'll pass it off to Tristan to add any flavor to my response. But I would say yes, there is a strong preference to someone who is working full-time in their venture. Tristan, do you have
Thank you.
anything to add to that?
No, chef's kiss, that was perfect.
Sure.
Yeah, the reason, if we really break it down, it's just availability and dedication to program. If you are Jocelyn rather, a full-time job, the only other instance I might say is if there's a team member who's full-time, if it's not you, but there is another full-time employee who is a decision maker, who is invested in the work and who can speak on behalf of the work, that potentially could be an exception. But again, with the number of like meetings with partners and whatnot, just being able to be truly focused on the business, it does make quite a difference in your traction and growth while in program.
Yeah, and
Thank you.
just to add to that, what we found has been beneficial is if the leader, whoever it might be, is able to attend the national conference and is able to continue on with the programming, at least more than 50% of the time, just so you can kind of bring those relationships along with you all as you go through the program. So we have seen in the past, like where it has been like someone has attended the conference, but they haven't attended the sessions, and it just can be at times a little bit disjointed. So if there's any way to kind of bridge that, that'd be great. Lastly, I did see that there was a question about alumni benefits in the chat. I'm not sure if that question was addressed or not.
Oh, great. Good catch, Tiffany. Tristan, would you like to address the alumni benefits question?
Got it. So alumni benefits, they follow the founder, not the organization, or the participant, I should say, for as long as you're a founder. And so the way that works is you complete a post-program survey, and that unlocks access to our alumni benefits. And it is basically a platform or a resource center where you can ask for additional mentorship that is certain specific content. So somebody, let's say in legal or somebody in marketing. There are also just resources. There's a discount for HubSpot, for example. There's a direct line into Kiva Loans. And that platform is available to the founder in perpetuity. And then we have a community of Slack and LinkedIn for you to keep connecting with our SeedSpot more broader network. There's about 3,000 alumni over the course of our 12 years since we started. So just a couple friends. And the only thing that we ask is annually there is an impact survey. SeedSpot is a nonprofit. We love data. And so we do a little check-in with you annually to see where are you at, what's the progress, either with this company, potentially a new company, and then we report out on that. And so every year that survey will come back to you, you'll complete it, and then gain access again.
And there may be unforeseen benefits. Like Kayla mentioned, she is currently on the VOA Board of Advisors. So we can't predict that, but there are benefits that are yet to be determined. If there are no more questions, I'll just wrap up by saying how privileged I feel to work with all of you all. You all have so many incredible solutions and you're doing incredible, impactful work. I appreciate every conversation I have with each and every one of you. So please feel free to utilize me as a resource if you have any questions to follow up. I will share out this recording. And I will also share out a PDF of the application questions so that you can take a look at what we're expecting. And if you have any questions about any of those questions at all, please reach out to me. I'm very responsive other than this holiday break, which will be taking off until January 2nd for a much needed respite. Okay. Thank you all so much for joining. Have a great rest of your day and happy holidays, everyone.